Today on the Transplant Helper, we're going to be discussing many of the medications that you and I are on post-transplant. Going to be talking about the usage, the side effects, my personal experience, as well as some precautions that you need to be taking, particularly with a few of these medications, if not all. Go ahead and stay tuned.
Hit the subscribe button and the bell notification to become part of the Transplant Helper community.
Hey folks, welcome back to the Transplant Helper again today. My name is Jim Merle, and in a nutshell, you might say today is basically a review of my medication bag. Now, if I haven't introduced you to my medication bag before, this is it. Yes, it is humongous. This actually happens to be a CPAP bag, so typically you would house the CPAP machine, the mask, all the accessories, the power cords, everything in here. But for me, it makes a wonderful, wonderful general transportation medication bag. And I say that because it's not only large, as you can see, it's huge, but it's also padded, also somewhat insulated, and has an adjustable carrying handle, just like a nice suitcase or purse that you can tote around, and it holds everything for me. Now, as you can also hear, I don't have everything out of here today to talk about today, so there are plenty more in here, but we're going to be discussing the major ones here in just a moment. Also, let me add, if you want to jump ahead in this video to different medications, learn more about one or the other, just skip all around. I'd be happy for you to do that. Timestamps will be in the description below. You can go ahead and click those. That'll move you through the video in any pace that you want to go in. But while you're doing that, go ahead and give me a big like or a thumbs up. Just thanking me for allowing you to do that. Well, actually, you don't owe me anything, but I'm asking you to please give a thumbs up to this video. While you're here, that helps the YouTube algorithm and also encourages me to make more content like this. So let's jump right in. We're going to be talking about the major medications that I've experienced, have experience with, perhaps many of which you're dealing with as well. The very first one in my medication bag, the first one out of the bag every day, happens to be this drug right here, mycophenolate acid, also known as Myfortic. Other variants of that are Zolpidem. Now, this medication is extremely important because the major use of it and a couple of others is to actually prevent rejection. So if you had an organ transplant, at least currently the way things stand, you're going to need some anti-rejection medication to be on board all the time. So these are medications you're going to take 24/7, around the clock, 7 days a week at different varied times, and you're going to need to keep these medication levels consistent in your bloodstream. So a lot of times your medical teams will take blood work just to draw and to see what level of medications you have in there and make those adjustments based on blood work, not just on a general blanket recommendation for everybody. Now, as far as precautions you need to take with this medication, there are basically a couple. The main one comes down to potential for birth defects. So generally, 9 out of 10 times, it is advisable that if a woman is on mycophenolate acid, Zolpidem, Myfortic, whatever, that she does not decide to get pregnant while taking the medication. Now, I've seen many success stories where women are actually able to get pregnant because they generally adjust the medication, change it over to something else. They just take a lot of extra precautions. That's certainly something you need to sit down and talk with your team about. In addition to that, as kind of a little farther back from that, if you even happen to be the male in a relationship, it is not advisable the male gets a female pregnant while taking the medication because, again, there is still that risk of birth defects and other issues. So just check with your team before any of that topic comes up in your life. Now, as far as side effects go, this medication, like several more I'm going to name, most of the side effects come down to gastrointestinal type issues. Things like general gas itself, things like nausea, vomiting, stomach pains, that sort of thing is very, very common with this medication. Constipation, things like headache, gas. And one of the things I dealt with personally, other than some of that in the beginning, is I actually dealt with the tingling and prickling feelings in my hands, feet, and even in the weirdest place, actually on my thigh. I'm not showing you that, but right here on my thigh, there's a place about that big that right in the beginning when I was on high doses of this medication caused me a ton of problems. Just severe burning pain. Sometimes it was positional. I could move out of it. But in general, nothing worked. The doctors couldn't figure it out. No pain medications of any kind, even nerve pain medications helped. We just didn't really know what was going on. As it turns out in hindsight, that was probably a side effect to mycophenolate acid or Myfortic. And so once we changed my medication, one between the other version of it, mycophenolate acid to Myfortic and back, I noticed that coming and going. So we found out, yeah, that's probably what I was dealing with at that time. But this medication, again, is a wonderful one. It's one you're generally going to be on anyway as a post-transplant patient, but just be aware, like all of these, oftentimes you just got to kind of notice that the benefits outweigh the risk in this situation. That's certainly the case with this one right here. Next, we're going to be talking about Tacrolimus, also known as Tacrolimus, is the way I say it sometimes. Prograf. There are other variants of it as well. Some of you are on other drugs like, and I can't hardly say this one, but Inyovaris. I've never actually taken that one. Astrograph is another version of that. If you're taking medications like that, again, the reasoning behind it is because it is an anti-rejection type medication. It is absolutely essential that you take these medications regularly, where they got you on 12-hour rotations, 4-hour rotations, whatever. Take these medications regularly and have your blood work done as often as they require. In the beginning, that may be every week, every 2 weeks, every month, out to every 6 months is basically what mine is now. Have the medication levels checked, because it really doesn't matter. For some of us, you may be taking 6 of these little pills a day. Others may take 2 and get exactly the same effect. So you really got to keep a watch out for that. Now, this medication for me, the major side effect, and it's, by the way, the major one listed on any website, comes down to headache. I was actually prone and had severe migraines all growing up into my adult life and such. And one of the side effects of this is it can cause headaches. And it certainly did for me. That's one of the major ones. In addition to that, kind of much the same as the previous one, diarrhea, constipation, stomach issues, nausea, vomiting. Add to that weakness, difficulty sleeping, and then the one we all notice, potential for tremors. I'm not having them right now, at least maybe I'm not. But anyway, in the beginning on larger doses, tremors were terrible. Things like eating rice, peas, anything that required a spoon like soup, you can forget it. May as well put on a bib or an apron and go at it, or do it with my hand, because I wasn't going to be able to accomplish that. That was kind of uncomfortable as well as embarrassing in the beginning. That's what you deal with a medication like Tacrolimus. The next one up on my list, at least, comes down to another one, and that is called Diltiazem. Now, Diltiazem, typically speaking, is actually blood pressure medication. It's a really good blood pressure medication, very widely used, very cheap. But Diltiazem for me is not about blood pressure. It's actually about maintaining the Prograf levels in my bloodstream. So somehow or another, this medication helps this one to stay in my bloodstream. So in essence, I get to stay on a lower dose of this because I take that. So it's just something my team knew about or stumbled across, and for me, it works well. So I take Diltiazem. Side effects for Diltiazem are kind of like other blood pressure medications. They come down to things like dizziness, weakness, fatigue, heart rates that may be up or down, blood pressures that could be sporadic depending on how long it's been since you've taken the medication. Generally, I'll have a little bit of a drop in my blood pressure and heart rate for an hour or two after it, and it'll pick back up to normal. That's the sort of things you need to watch for with Diltiazem. Next for me, of importance at least, comes down to this one right here, Zolpidem. Zolpidem, also known as Ambien. If you take things like Tacrolimus, Prograf, things like corticosteroid prednisone, which I'll mention later that I'm no longer on, thanks God for that, that I'm no longer on, you're going to possibly need some kind of a sleep aid. And for me, as terrible as it is, Zolpidem happens to be mine. Now, Zolpidem can cause all kind of problems. I generally warn anybody, if you've never taken it before, don't start today. But once you're on it under a doctor's advice, be absolutely sure, listen to me closely, that you take it exactly according to your physician's recommendations. This thing can be addictive. It can be something that is abused. You need to be really cautious with that. As a matter of fact, when I go to pick it up, I have to show my driver's license, a controlled substance. But for me, it gives me the most successful sleep. Now, side effects are obviously going to be, things like having difficulty waking up, difficulty functioning the next day, potential for fog and dizziness, lightheadedness. In the moment of taking it, if I'm not really cautious, and I've done an entire video series on that, I'll link up here. But in the moment of taking it, I have to be very cautious that I go right on to bed, because if I stay up, I do some crazy stuff. I mean, up walking around, sleepwalking almost, albeit I'm wide awake, not aware though. Sleep eating is huge. I found myself, standing in the kitchen frying a hamburger in the middle of the night, not even remember doing it the next day. Kind of common. You need to be very cautious on a medication like Ambien or Zolpidem. Again, take it exactly according to your doctor's recommendation. My personal experience is that I sleep well. My other personal experience is you're going to have some issues. You're going to do some dumb stuff. So be very, very cautious. Do not ever operate a motor vehicle. I would advise you lock your doors and keep yourself in the house while you're taking this. And for me, thankfully, it wears off by morning and I'm fine. But anyway, that's what it is. Number next on my list, at least, not necessarily related to transplant, albeit it's something I need. That happens to be this, and that's Sumatriptan. Now, that is basically, I just went blank. What is it? Imitrex. Basically, it is a pill form of Imitrex, and it is the winner for me. Again, I've had migraines my entire life. Had a lot of difficulty with migraines throughout my life, severe migraines. Imitrex or Sumatriptan, these one right here, these are the 50 milligrams. They help me if you take it in the very onset. Now, I have what is known as a, I lost that word too. Oh, I don't know. Anyway, I have an aura. Called an aura, where I can know through my vision, through other things like tingling or numbness of the hands, that a migraine is coming on, and you take it immediately. And for me, it works. Generally speaking, I'll have some issues from the medication I'll mention in a moment, but generally it'll keep the headache from ever coming to full blown. So it works well for me. It's what I have to do. I don't enjoy the medication, though, because side effects for it come down to muscle aches, pains. I have shooting pains. It's like my bones hurt, particularly my ankles and feet. Heart rates can go up and down, which as a heart transplant patient, I don't like that feeling. But again, one versus the other you have to deal with. Just one of the medications I'm on, not common to all transplant patients, but certainly one that I take. Now, one that is not here, it is this empty spot sitting right there that I'm proud is empty, is I no longer take Prednisone. I call it the devil's drug in many of my other videos. I no longer take Prednisone. Prednisone is a corticosteroid that is a major, major drug, just as important as Mycophenolate and or Prograf in your anti-rejection stages, especially in the beginning. Oftentimes people are taken off of it within a year or two. Some people are on a low dose, a maintenance dose of 5 milligrams for a lifetime. But when Prednisone is in your bloodstream in the beginning, the tremors are awful, the anger, the mood swings, terrible. Again, I got videos about that. It's just not a fun medication at all. It's a necessary evil, certainly a very evil one, but it's not among the most fun medications at all, but it's something I've taken in the past, as much as like 65 milligrams a couple times a day, down to the 5 milligram taper dose, unto nothing now for the last several years. And I'm thankful for that continues to be an empty spot in my medication bag and on my desk. Up next for me, not for everyone, but I take a medication called Omeprazole. This is prescription Prilosec, okay? As a result, this is just personal, may not apply to you, but as a result of taking Prograf, Tacrolimus, Mycophenolate, all these other medications for as number of years that I have come down with some issues with my liver, particularly cirrhosis of the liver. Now, it's considered mild to moderate. It's not really a problem. My blood work looks pretty good. But that difficult with the liver kicks off something that's kind of hereditary in my family that I've never dealt with, and that is some GERD or acid reflux. And Omeprazole did the trick for me. It was originally intended for me to be like a 30-day reparative type thing after some discoveries they made with some upper and lower GIs, that type endoscopy type stuff. But it worked well. When I went back off of it after 30 days, I started having problems. They put me back on it. I think recommended on the bottle, these are 20 milligrams. I'm supposed to take them 3 times a day with a meal. I only have to take 2. I take 1 in the morning, 1 at night. Could probably even get by with just 1. But yeah, good medication for me. Not related to everyone, but sometimes the fallout of one medication or another, or a long period of time being in some kind of failure, can lead to other issues like acid reflux. So I take it. Number next, and these are down to supplemental type things almost. Next on my medication list, at least, of importance is an 81 milligram aspirin. A lot of us are on that. I'm no longer on blood thinners, thankfully. I've been in there and done that before. Not a lot of fun. But I do take an 81 milligram aspirin every day just to prevent, particularly calve. And I've got a whole video on calves. You can check into that. I'll put it up here. But particularly to prevent calve or calcification of the arteries, that sort of thing. And I take that every single day of my life, just the one, and hopefully that's doing the trick. So far, it seems to have done enough. Others might have to go back on blood thinners or back on some other type medications to help with that, but for me, it works. So that's what I take every day. Up next, as far as importance to me, I'm going to take magnesium oxide. These are 400 milligrams a day. If you're a post-transplant patient, it is very, very, very common that you are told at some point that you have very low magnesium levels. Now, a lot of times when that is told to you, there'll be a panic. They'll start loading you down with pill form. I've taken shot forms, I've taken injection forms, I've taken IV forms, all of that, and it seems to almost do nothing. I'm on the highest oral dose you can take every day, which in this case is 400 milligrams 3 times a day times 3. So what is that, 1,200 times 3 or something? I'm on the maximum oral dose you can take every day, and even still, my mag levels are a little bit low. Here's a trick to that most people don't realize. Magnesium levels are not very well monitored just through simple blood work. As a matter of fact, the magnesium levels typically, to get an accurate measurement, need to be monitored in the bone marrow, which nobody's going to fall for that, right? But they would actually go into the bone marrow to see where that magnesium is concentrated. They may find out that your levels are higher than is assumed, but nonetheless, I still take this as a side note for me. Low mag levels cause my, oftentimes can trigger my migraines. And so it's kind of this one goes with this one to go with this one to go with this one, right? In that case, to try to prevent some of those migraines. So higher mag levels for me, I do better. In addition to that, it helps me rest at night. It's not directly related as a sleep medication, but low mag levels can cause you to have difficulty sleeping, restless legs and such. Helps me out. And that's one that's on my list. Up next, that goes along with that, would be magnesium. Oftentimes requires calcium or calcium carbonate to help it stay in your bloodstream. So dealing the fact with that is the case. That's why I take calcium carbonate. In addition to that, many of us as post-transplant patients, because of this medication, and this medication, deal with certain forms of osteoporosis, or in the earlier stages, osteopenia, which is kind of early stage of that, where you start to have some bone loss. And so calcium carbonate is a help for that and a fix, a preventative for that long term. So oftentimes you'll take things like calcium carbonate. The last medication I'm going to discuss, and again, there are plenty right here, that I take every day, is a vitamin D3 supplement. These happen to be 500 IUs. Vitamin D. Vitamin D is extremely important to your immune system, okay? People think about vitamin C and the benefits of it. Vitamin D is as important, if not more so, to your immune system, and especially in the wintertime when we get less vitamin D from being out in the sun and what have you, you're going to need a supplement. Everybody pretty much. Check with your doctor. Get them to measure your levels and see what you need and make some recommendations. But vitamin D makes a tremendous difference in your immune system. Now, the question that always falls out of that is, wait, I thought they were trying to keep your immune system down, to keep you out of rejection. And so they give you things like mycophenolate, Tacrolimus, Prednisone. Yes, exactly. But this is kind of another facet of the immune system, not just the immune system as far as its potential attack on organs, but just for preventing sickness. Vitamin D levels, keeping them up, make a huge difference. And they also help with this one here, sleep. Okay, vitamin D levels, low vitamin D levels can cause you to be restless and have difficulty going to sleep. So every one of these things kind of go together. One helps the other, that helps the other, and rounding them all up, there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 right here. About 10 more in here that I generally do not take, but out of the major 10 I take every day to some point, they kind of all work together. So that's the main thing you need to take away from this video, not just what each medication is for and the uses and the side effects, but generally this is a package deal. So you really need to spend a lot of time with your team, your physicians, and your pharmacist talking about your medications, making sure you're taking the right combinations and levels and such are right in your bloodstream so that they can make the best choices, so that these things can work in conjunction and coordination with one another, and you'll get the best positive result. Now, here's what I want you to do. First of all, I mentioned earlier, give me a thumbs up on the video. That helps a lot. Be sure to subscribe to the channel if you want to find more content like this. I'm looking forward to 2022. And then really this one is huge because this is not the Transplant Helper. This is the Transplant Helper community. You're a part of it. You're a part of it. All of you are part of it. Comment below. Let me know some of the medications that you may be taking that I'm not, or maybe some experiences about one of these that may be a little bit different. Let me know what you're experiencing with your medications and what you're dealing with or what you're taking. That can help us all as a community. Thank you so much for joining me today. Until next time, stay stronger, friends.